Hello, everybody. This is Senior Advocate. Welcome to our Zoom seminar on COVID-19 and the variants. We are so happy to see some of you online. We've been super happy the last couple of weeks. We've done some in-person events, which we hope to continue. We're going to have to see what Dr. Patel says about that during this seminar. So she was so gracious to accept our invitation to come tell us about this. I know we all hear conflicting news on the variants, what we're supposed to do, what we're not supposed to do, if we're vaccinated, if we're not vaccinated. So we're thrilled to have Dr. Patel. I'm going to introduce her in just a minute. We also have a wonderful sponsor and partner who we love working with. That's Humana. And we have Ian Galvin, and he's just going to say a few words this morning or this afternoon about what they do at Humana.
Thanks so much. Yeah, thanks so much, Stephanie. I appreciate the opportunity, first of all, to join everyone today. I wish that were something more lighthearted and fun. We had a reason to congregate and talk about, but when we learned at Humana that we had this opportunity to kind of partner up with our good friends at Senior Advocate and our good friends at GenCare to share some really important information with our community, we just jumped at that chance to do so. A little bit about me. Again, my name is Ian Galvin, and I have been working with Humana here in the Tidewater area for a little over 8 years now. Just had my Humaniversary, as we call it, this past July. And really the whole time I've been working very closely with the GenCare folks. They've been just such a great partner for us at Humana. If you don't know a lot about GenCare, you're going to learn a little bit more about that today, of course, I'm sure. And also, if you didn't know that Humana is one of the only carriers that's accepted over there at GenCare. So we've always had a very, very close working relationship with those folks, and just really applaud the efforts that they make to keep our seniors healthy and active and going strong. So, again, it's just a pleasure to be here. Happy to be able to share this information with you. My contact information will be shared at some point in the presentation. So if you ever have Humana questions that you'd like to direct to someone in the know, I'm certainly happy to do that. Whether you have another agent in town or don't have an agent at all, please feel free to reach out to me and let me know if you have any concerns or Humana-based questions. We've got an office over at the Janif Shopping Center at Humana, and unfortunately, it's not open as we wish it was, kind of full speed right this second. I'm sure a lot of you can understand that we're being very cautious and making sure not to put any of our seniors at risk. But hopefully very soon we will have all this in the rearview mirror and be, partying full swing and doing silver sneakers classes and educational workshops, just like none of this craziness ever happened. But again, it's just my pleasure to be here, and just thank you, Stephanie and Dr. Patel, for partnering with us on this fantastic event and afternoon. And without too much further ado, I'll turn it back over to Stephanie so she can introduce our keynote speaker.
Excellent. Thank you, Ethan. So just a couple of housekeeping notes. We are going to have the presentation, and then we're going to take questions after. We have had quite a few questions emailed to us, which is great. What I would ask, if you have a question, you can type it into the chat box. If you don't know where that is, just take your little scroll down to the bottom of the Zoom page meeting that you're looking at right now, and the icons will all show up at the bottom of the screen. Chat is in the middle. You just click on chat and you can type away, but you might want to wait until she's done with her presentation, because she may answer some of the questions during the presentation. So I'm going to go ahead again and introduce Dr. Gashmal Patel. I want to tell you a little bit about her. She received her bachelor's degree from the University of Virginia and a medical degree from the Medical University of Lublin in Poland. She's currently a member of the American Board of Internal Medicine. When she has spare time, she spends it with her family and friends. She also enjoys exercising, cooking, and painting, and apparently presenting to us and talking to seniors. So thank you so much again, Dr. Patel, for joining us. I'm going to turn it over to you now, and we are very interested in what you have to say today.
Thank you so much, Stephanie, for that introduction. So like she said, I'm Dr. Patel. I do currently work at the GenCare Senior Medical Center in Hampton, Virginia. I have been here for 2 years, and I did work at the Newport News GenCare as well. So actually all my professional career has been with GenCare. I really enjoy working with seniors and educating seniors in the community, which is one of the reasons why I'm here today. So if anyone has any specific questions about that, I'd be happy to take those as well as your questions about COVID-19 and the current situation that we're in. So I have prepared a presentation that I will share with you all today. Most of this information comes directly from the CDC and other public health experts. So, as Stephanie said, we will be able to take questions at the end. So please chat them in. If you have any specific questions about my references, we can also go through as well. So in general, I wanted to really touch base on what, the word variant means first, because this is something that's new, not something that we've really had to talk about in terms of other viruses that have been really around during our lifetime. There are definitely flu variants that we talk about and worry about, but they haven't been as problematic as the COVID-19 virus. So in general, a variant means, that it is a different form of an original virus that is circulating, and they're actually genetically different. And viruses are very smart. They tend to mutate and create different, forms of themselves that might make them more infectious and spread more easily among humans, which is obviously what we would be worried about. And then, why are these concerning? Like we said, they are very smart. They can spread easier, faster. They can unfortunately be more lethal. And what we're really worried about right now in the United States is that our current treatments and vaccines that were previously created, they may not target these new variants as well. When we talk about a map or a puzzle, if something quite doesn't fit where it used to, obviously that can cause, changes in the overall picture. So I just wanted to share, where we are right now in the United States. So we're looking here from where we started with the pandemic. We had a huge spike around the holidays in the winter time, as everyone I'm sure remembers. And unfortunately, currently we're trending up as well with this new Delta variant, spreading across the country. This caseload here that's showing 235. I do believe that number is a little inaccurate. Sometimes after the weekend, a lot of cases are loaded in together. But if you look at the average here, that's a good number to look at. On average right now, we're having over 100,000 cases, every day in the United States, which is higher than we were early in the pandemic when we first, were exposed to COVID-19.
Patel, I just have a quick thing. It sounds like there's a little bit of static on your end. I don't know if you can turn your volume down a little bit. There's just a little bit of interference, and the slides look great, but just the interference with the voice.
Okay, I'll turn it down. Thank you.
Thanks.
All right. So when we're talking about Virginia specifically, these are the daily new cases every day since the pandemic has started, since the emergence of COVID-19. Again, you see that same spike around the winter time that we all went through, and then we really had a good early summer in terms of caseloads. But again, we're unfortunately trending up here in Virginia with the new Delta variant kind of surging across the state. The COVID-19 variants specifically, so there are numerous variants that have been identified all over the world. Only some of them are clinically significant, just because we are able to see under a microscope or with lab tests that viruses have variation and differences, doesn't mean that actually means anything to us as humans, or whoever the virus is infecting. What we do know is that all these variations still cause the same disease. And it's so the SARS-CoV-2 virus, all the variations of it still cause COVID-19 in general. So it's not a new disease that we're talking about, but unfortunately a variation. And the Delta variant right now is the most concerning variant across the United States, and it's causing the spike that we are currently in. So just talking a little bit more about the Delta variant specifically, it was first identified in India in December of 2020. It has been traveling around the world due to its very contagious nature. And at this time, and actually today, the CDC is estimating that about 93% of new infections are caused by this Delta variant. The Delta variant, like we mentioned, it's more infectious. It does spread faster than all the earlier forms that we have been exposed to. And if we're talking about how much more contagious it is, we're estimating that it's roughly 2 to 3 times more contagious. And that's factual. We have seen that now in studies. And there are also a couple studies that show that it's possibly more severe, although I don't want to say that that is something that is set in stone. There's still a lot of data coming out about that. Okay, so just to look at the contagion factor, if we look here at this diagram from the CDC, we can see that originally the COVID-19 strain, if you were infected, you could possibly pass it on to about 2 other people. That's what the flu is like. COVID-19 is a little more contagious than our regular flu, but very similar. But now when we look at the Delta variant, we see here that one infected individual could potentially infect 2 to 3 times as many people as the original strain, which is obviously very concerning from a public health standpoint as well when we talk about, overloading our health system, okay? The more severe illness point that I touched on, like I said, that is not really set in stone at this point. There is some evidence that is showing in different countries, so Canada and Scotland specifically, that shows that these people are likely to be hospitalized more, unfortunately, compared to the original virus strains. There is apparently some data that they are working on now that should be published in the next 2 weeks that will give us a lot more information about this specifically. So what does this, really mean for us? So first of all, we have 2 groups of individuals that we can kind of separate everyone into. The unvaccinated, are the people that remain the greatest concern. They, not only have a risk of getting sick, but also a risk of transmission, among others who are unvaccinated as well. So they're more likely to contract the virus and then spread the virus. They also are much higher, at risk for severe disease, which unfortunately can include hospitalization and death. So we're seeing now, that 99% of people that are dying are actually unvaccinated. There is a long vaccination process. So, some of those people may be partially vaccinated, but when we're talking about the full protection that we have to offer, it's something that we have noticed really impacts your risk of severe disease and hospitalization. And then when we talk about the fully vaccinated, what does that mean now with the new Delta variant? I know in terms of my patients specifically, after a lot of, education, frequent visits, question and answers, I've been able to, comfortably vaccinate 90% of my seniors, which is great. And I'm still working on every patient of mine that's unvaccinated. But again, unfortunately, I am even worried about my fully vaccinated patients. With the Delta variant, there's a higher risk of breakthrough infections. So what that means, the term breakthrough, I know it's all over the news now, is that you are fully vaccinated and you still, unfortunately, have a positive test, whether you have symptoms or not, okay? Fully vaccinated patients with the Delta variant, we do feel, unfortunately, can also spread the virus. So with the original, COVID-19 strains, we did feel that a vaccinated person was less likely to spread the infection because the virus levels were very low in those individuals. But however, with the Delta variant and the breakthrough infections, we are seeing that vaccinated individuals are more likely to spread the virus, although that time period of being infectious seems to be much shorter. And then just as a reminder, when we're talking about fully vaccinated people, what does that mean? It means that if you've had either the Pfizer or Moderna vaccine, you are 2 weeks out of your second dose in that series. So for Pfizer, that's a 5-week process, and for Moderna, that's a 6-week process. And then for Johnson & Johnson, that vaccine is a 1 dose, so it's 2 weeks total after you get your first dose that you're considered fully vaccinated. And now when we talk about the vaccines, we're talking about breakthrough infections. What does this mean about our vaccines? Should we still trust our vaccines? Should we still focus on vaccinating people? Absolutely. We do know, luckily, these vaccines are highly effective. They are effective against the Delta variant. Like we said, there are those breakthrough infections, but we are not seeing an increased risk of serious illness or death in these fully vaccinated patients who are getting breakthrough infections with the Delta variant. The mRNA vaccines, which are the Pfizer and Moderna vaccinations, they did release some data that showed that they feel that the vaccines are about 64 to 88% effective against any infection in general, and greater than 90% effective against severe disease. So again, the vaccines are highly effective at reducing severe illness, which includes hospitalization and death. And that is huge, especially when it comes to seniors, because those are the complications that we're the most worried about. So for the unvaccinated, my recommendation is to get vaccinated as soon as possible. Talk to your primary care doctor about any specific health concerns that you may have. In my opinion, almost every American is eligible for a vaccine, and there are different options and different timelines that you can work on with your provider. The public health experts do predict that every American will be exposed to the variant just because of its contagious nature. And so our really only shot at, first of all, limiting the spread, but also protecting ourselves individually is to get vaccinated. And the process is long. So working as soon as possible is very important. We have administered over 300 million doses. So I truly feel the vaccines are very safe. I've seen them be very effective. We have had a couple of breakthrough infections that I have been involved in, taking care of these cases. And these symptoms are extremely mild. I have yet to see a vaccinated patient actually get sick from COVID at this time, which is really what we're trying to prevent. I do recommend to mask until you are fully vaccinated, and to continue to choose low risk activities. When we did have a very low caseload in the summer, I know there were a lot of mixed messages about vaccinations, about masks, about activities, going back to some pre-pandemic activities. However, with the surge, the CDC again is recommending to mask in places where you are indoor, where you are not able to social distance. And I would say that's really the case whether you're vaccinated or not. If you have symptoms or you are exposed, you definitely want to let a health professional know immediately. There are appropriate testing and treatment options that will be available to you. And if you're unvaccinated, you definitely want to get those treatments underway as soon as possible to help prevent severe disease, hospitalization, or even worse. And then the vaccinated, I know a lot of people had taken that plunge and got those vaccines. Like myself, I was very excited to get vaccinated early on when the vaccinations came out in December and January. But, now we are hearing all this mixed messages about how effective are our vaccines. We need to still stay vigilant. We are not superhuman, even though we have been fully vaccinated. The Delta variant, the difference in the genetics with it are not making our vaccines as sensitive when it comes to actually contracting the virus. I do recommend that you mask in high-risk indoor places where you can't social distance, especially if you live in an area that's high transmission. So Virginia is right now considered moderate to high in terms of transition risk and rates. Most of the United States, unfortunately, is in this state at this time. And again, if you have symptoms or you are exposed, we definitely recommend that you let your healthcare professional know right away. We are recommending testing and possibly treatment depending on the specific situation. Also important to note that your symptoms might be much more mild. And the reason is because you do have antibodies to fight COVID-19. So you may not get those severe symptoms that we were seeing last year. You actually may have symptoms that mimic a cold or possibly a sinus infection. And so that's really important to be aware of, to talk to your doctor about. And definitely, you want to be very careful in areas that have low vaccination coverage. A lot of the states in the deep south, so Florida, Louisiana, Missouri, Georgia, Texas, they are still working to ramp up their vaccination rates. But as a result, there's more risk of being around people who are unvaccinated. So I would definitely be cautious or avoid those areas, as we probably will see a lot more spread of the Delta variant over there. I would say Virginia overall is doing pretty well in terms of our vaccination rates, which is aligning with our, trajectory slowly going up instead of seeing a huge spike as we're seeing in some of the states that are a little more south to us. And I just wanted to remind everyone again of the symptoms. It's been a long, almost 2 years soon, that we've been dealing with COVID-19. So these are the most common symptoms of COVID-19, and the Delta variant symptoms are exactly the same, especially in unvaccinated individuals. Like I mentioned, if you are vaccinated, you may have more mild symptoms, but if you are experiencing these symptoms, definitely important to get with your healthcare provider and figure out a plan to see whether or not you may need to be evaluated for an infection. And just wanted to kind of summarize and really, touch on some key points. So I just wanted to make sure everyone understood that, the surge right now is really affecting the unvaccinated. And 90% of the new cases are actually in that group. And as I mentioned, 99% of the deaths are also among the unvaccinated. So getting vaccinated is our really, best shot at protecting ourselves from this Delta variant. And, as a member of the community, I think it's important for all of us to encourage each other, our family and friends to get vaccinated as well. I want everyone to remember that we need to stay safe and smart and vigilant despite what's going on around us. I know right now the mandates and things are changing left and right, but being comfortable with the situation is super important. And if you are in a high risk situation, get out of that situation, and come back, or change your plans, because there are people in the community that may not be as vigilant as we would like to be. And being in contact with your primary care doctor is extremely important after an exposure to help limit spread in general, but also to help treat yourself individually. So now, I will take up any questions. I did include our office number here in Hampton in case anyone has any questions for me specifically.
Okay, we have actually quite a few questions that were emailed to us beforehand. So I am just going to go ahead and read some. I see that we had one posed on in the chat room, and that was about masks and where can we purchase suitable masks. And she specifically asked about many of the masks are being made in China. Are they safe? Is there a brand that we should be using?
Okay, that's a great question. So in terms of masks, I wouldn't really focus on where they're made or where they're coming from. We are really just looking for a cloth covering or, a shield to protect our mucus or any particles that may come out of our mouth when we're talking from spreading around us. So really your mask is protecting others around you more than yourself. It definitely does help and seems to diminish spread. So that's why it's important to be in areas where people are masking. And if you aren't able to social distance from people who aren't wearing masks, then that's not a good place for you to be in.
Okay. Another question was about the plastic face masks that come, and I've seen them where they come around. If they do cover your face and the bot in your mouth, are those appropriate? Are those as good as the cloth masks?
That's a great question. So those plastic shields were actually originally created for healthcare workers to help protect their eyes from any particles going into the eye mucous membranes. So those are great for eye protection. In the community, I don't feel that those face shields are very high yield for protecting you from COVID-19 and particles. It's very rare to be in a situation where the COVID-19 particles are actually in the air unless you're in a closed healthcare environment where you are around patients with COVID-19. I don't feel that the shield is great at getting and catching all the particles that may come out of your mouth. So I do recommend, a closer fitted mask, like a surgical mask or a cloth mask specifically.
Okay, looks like we have another question in the chat. For people who have been told by their doctors that they cannot tolerate the vaccine, what are their options?
So that's a great question and, a very tough situation to be in. There are a small subset of patients who are not going to be able to get vaccinated. So they're really depending on us to protect them. They are not going to be able to create antibodies to protect them. So the best thing to do, unfortunately, is to still avoid exposure, to social distance, to masks, to stay out of high risk areas, and to promote your friends and family to get vaccinated so that our communities can, achieve high vaccination rates to really try to spread the surge.
Okay, another question in our chat box: is it safe to go to a restaurant or a place of business where the employees are not masked?
So that's a really good question, and I would be very cautious with that right now in terms of the Delta variant spreading. It is safe to assume that most facilities, including restaurants, people who are not wearing masks, are following, the new guidelines that did come out previously of, that recommended if you're vaccinated fully, you do not need to wear a mask. However, now that the Delta variant is showing a lot of breakthrough infections, I personally feel that those employees, even as they are vaccinated, may spread the Delta variant to their customers. I don't anticipate the state really changing or governing new mandates, unfortunately. So I would recommend, for this short period that hopefully we're going to fly by through, just like our surge in the winter, to try to do takeout, try to eat at home. Eating outside is a much safer option as well. So those are definitely good options.
Okay. We had another question that was emailed to us, and that was, if you feel like maybe you have the virus and you have some symptoms, what do you do? Do you go to the ER? Do you go get a test? Do you go to your primary physician? Call 911?
Yes, that's a good question. So first of all, it depends on what your symptoms are. If you are feeling extremely sick, feeling like you can't breathe, you can't get oxygen, absolutely, I would call 911. I would definitely let your primary care doctor know what's going on so that they know where you are. They can the doctors in the hospital or the emergency room, let them know about your medical history so you can get the best care that you need. But if your symptoms are more mild, you feel like you're able to pick up the phone, maybe even go visit your doctor, call your primary care doctor. I know here, where I work, if someone were to call me in that situation, we would actually perform your COVID test. We would decide if you needed treatment. We would decide if you needed to go to the emergency room. We would help you make those decisions, in a smart way that works best for each individual case.
Okay, thank you. Let's see what other ones we have. This is a great question that comes up all the time. Compared to the flu, how many people have died from the coronavirus. We hear people say the coronavirus is nothing different than the flu that we get every year. Many people die of the flu, many people die of COVID. What's the big deal?
That's a good question. So the flu is definitely something that does significantly impact us every year. I think the biggest difference that we're seeing with COVID-19 is that it's not episodic based on the seasons. We may have, an infinite amount of surges, and we have lost over 600,000 Americans at this time from COVID-19 and over 4 million people in the world. This may be unfortunately something that is part of our new normal, but it looks like the vaccine is a good tool to hopefully help spread it, stop the spread. So it's not like the episodic flu season that we experience every year. We also don't have as great of a tailored treatment to COVID-19 like we do to the flu. Most people who get the flu do not get admitted, do not die. And so those are the, major differences that make it kind of a more unpredictable virus. In terms of, how many people die from the flu, it's really different every year. Last year, I had no flu cases here in my office because of the masking. So maybe we can even stop and slow down the spread of the flu, which is also, a very severe disease that we struggle with every winter.
Okay, we have another question in our chat room. They say, I am vaccinated. If I get an accidental exposure, can I transmit the virus to others even if I don't feel ill?
So unfortunately, with the Delta variant, which is the new major virus that is spreading across the country, it does appear that a vaccinated individual can spread the virus even if they're not very symptomatic. We're still waiting, with all this data and all this new information. Time is one of the rate limiting steps to say for certain for all these types of questions. But it does appear that you are able to unfortunately spread the virus. The Delta variant has more virus that is in the parts of our bodies that allow us to spread and shed it more easily. It does seem to be a shorter amount of time compared to an unvaccinated individual. So that does still promote that, vaccines will help slow down the transmission, but still a concern, absolutely.
Okay. Another question we've had is, it safe for people who are all vaccinated to gather together without masks? Although you might have just answered that in your last question somewhat.
Yes. So I would say, that's tough. I want people to be able to see their family, their friends. In terms of, what's safe and not, it's really individual. If you are around, people afterwards that are immunocompromised or, infants who are not vaccinated, then maybe that's not the best idea for you and, what you have going on in your life. I do recommend, activities that are outside. I also recommend being in places where you can social distance, even if you're vaccinated, as much as possible. So just trying to tweak and make those small changes can go a long way. For me, myself, because I take care of seniors, I have to be cautious. I don't want to do anything that may be high risk because I could put others at risk at work. So that's my individual choice. And, it's going to be different person to person.
Sure. Thank you. Another question that was emailed to us, is it true that the coronavirus vaccines don't work as well in immune compromised people? And does that mean that they might be the first people to get a booster shot?
That's a good question. So I know the media has kind of been touching on this here and there. Immunocompromised patients, specifically that they're talking about who may need a booster first are those who are on medications that perhaps didn't make the vaccine as effective for them. So certain medications may not have allowed the vaccine to produce that strong immune response to get all those antibodies that you need to really fight COVID-19. So booster may be something that we're looking at. There's nothing that's really set in stone at this time, but if we do anticipate anyone getting the booster, I do agree that that group may be first.
Okay, looks like we have another question in the chat. Are there false negative test results? Is that something that's common?
So it's not extremely common depending on the test that you get. There are rapid tests, and those are usually done at commercial pharmacies. There's some home tests now that are available, and those are less reliable and less predictable. Those really are looking for a specific protein, and if it doesn't catch it, your test will come back negative. So actually, if we ever have a case where someone has a negative test, but we're still really suspicious of COVID, we would follow that rapid test up with the PCR test. The PCR test is much more accurate. I don't think that the false negatives have really impacted the way that the pandemic has been going. Absolutely, they're not perfect. So again, if it's negative, we sometimes follow it up with a second test because the swab has to actually touch the virus and get virus attached to it to come back positive. So nothing is 100%, and usually clinically, if a second test is indicated, it is done, and those usually end up being people that are unfortunately in the hospital.
Okay. Another question that was emailed to us: if you have the virus, what quarantine protocol should you follow at home?
So if you have a positive COVID-19 test, we are recommending, and by we, I mean myself as a physician as well as the CDC, that you perform a 10-day quarantine period from the date of your positive test or onset of symptoms if it was much before your test. The 10-day quarantine period has kind of been the standard for a while now. It came down from 14 days, and we don't feel that people are infectious after that time period, and that's why it is, the 10 days that we recommend.
Okay. And I know we're kind of switching all over. We're going back and forth, but there's so many great questions that we got emailed and that people are typing in. So I appreciate your patience in answering all of them. Looks like we have another one in the chat box. Is it safe to mix the vaccines when getting booster shots, like Moderna with Pfizer, Johnson and Johnson?
Great question. So first of all, booster shots are not yet recommended. So there's not a lot of information out there that will clearly delineate what the plan may be. I do anticipate that most likely we will recommend you getting the same vaccine that you got before, although it's not unsafe or dangerous for you, but may not be as effective. The same goes for, the 2-dose series. If you get one Pfizer vaccination, you want to get that second dose as a Pfizer vaccination as well, because that's how you get the strongest protection from the vaccine. That's how you build the most antibodies to fight infection.
Okay. For those who have not been vaccinated, what's the best way for them to find out where they can go? Is there a CDC website or a Virginia website that they can go to find all the places that are doing vaccinations?
Yes, so there's actually both. The CDC has a link that you can click on to find vaccines near you, as well as the Virginia Department of Health. But it is so easy, where we live here, you can literally walk into any pharmacy in the area. I know at my clinic, we do vaccines every day. So you can pretty much walk into any commercial pharmacy, call your doctor's office, and that is the easiest and fastest way to get vaccinated. Most Americans actually have gotten their vaccines from commercial pharmacies.
Okay. Here's another great question. This is interesting because it hits home. She wants to know, should children go on a cruise? We actually had a cruise scheduled last Sunday and we canceled it because we were worried about our 11-year-old.
Yeah, definitely concerning. And I know that's such a hard decision to make. And we've all been pushing out our plans and they keep getting rescheduled and rescheduled. I think cruises are a really challenging topic. They are a place where if infection spreads, it's going to unfortunately maybe touch everyone that's there. There's nowhere really to leave from. There's not a lot of open air in the living quarters. I truly don't think that I would recommend a cruise today for a child. If they're over 12 and can be vaccinated, I still think it's a high risk place to be. I would recommend, going to a beach and spending more time outside and maybe staying in a private hotel room versus a cruise if that's an option, just with the Delta variant really surging among, vaccinated people as well.
All right. And then to kind of follow up on that and talking about vacations, what are the precautions that one can take when traveling on an airplane besides wearing a mask?
Okay, great question. So I actually have had to take a couple of flights due to family reasons and work reasons during the pandemic. Airplanes are luckily extremely safe. They are constantly filtering the air in the planes. And so that is really the highest risk, of getting COVID when you're sitting next to someone is breathing the air that they may be breathing if they're infected. And luckily also masks are 100% mandatory on flights, and they're very strict and very good at enforcing this precaution. That also tremendously reduces the risk of transmission. So I do feel like there's no extra precautions that really need to be taken, except just the, same things that we would do if we were not on a plane, using hand sanitizer, definitely washing your hands before eating. If you can avoid eating on the plane, definitely recommend that. Probably not traveling too far so that you're not having to use the public restroom and, eat a lot when you're there is probably a good idea. But planes are very low risk, and I have yet to really hear of, a substantial amount of cases or risk from those types of situations.
Okay. Another question in our chat was, have the vaccines been approved by the FDA?
Great question. So again, something that's a hot topic on the news. The vaccines are all approved by emergency authorization at this time. Due to the situation that we were in as a country, the FDA felt that the risk of the pandemic was much higher than any risk from the vaccines based on the initial data. So they did authorize them for emergency use. However, in the next few weeks to months, we should see that the FDA officially approves, I believe, all 3 of the vaccines. I don't know the exact timeline. I don't think they know the exact timeline, but we should start to really see that before the fall gets here.
Okay. Another question that was emailed to us is, what age group is the most vulnerable at this time with these COVID variants?
So I would say in general, all age groups of unvaccinated people are very vulnerable. Unvaccinated seniors are going to remain the highest risk for complications, for hospitalization and death. And that is also people who are not just over 65, but also people over 65 who have any underlying conditions that may make them higher risk for complications. In terms of children, I know a lot of people are very worried about that as they're not able to be vaccinated. The majority of children who do get COVID-19 have very mild symptoms or no symptoms. There are unfortunately rare cases where children may get sick and end up in the hospital or worse, but this is not the norm. So really the unvaccinated seniors is who I'm worried about the most.
Okay. Another question that was emailed to us, how much exposure do you need with a virus infected person to get the COVID variant? So I think what they were asking, if you're talking to somebody for 5 minutes, you find out they had it, are you in trouble? Or do you have to be with them longer? Did you have to hug them?
Great question. So, this is kind of hard to measure, but in general, we talk about the risk of exposure. If you were around someone with COVID-19, and also other factors play into it as well. So if you're outside talking to someone who may have COVID-19 and you aren't aware, the risk of transmission is pretty low. If you're inside, wearing masks, talking, for an indefinite amount of time, again, the risk is very low. However, if you're inside, not wearing masks, not social distancing, and talking for about more than 15 minutes, I would say, that's really considered a high risk exposure. And that should be reported to your healthcare professional, your PCP, your primary care doctor, for evaluation for possibly testing after an exposure.
Okay. Another question emailed to us: what body temperature is considered high if you think you have the virus?
So when we talk about a fever, 100.4 is really, the cutoff for what medically we consider to be a concern. Everyone's body temperature is different, and sometimes you may feel feverish or warm above 99. But if someone hits 100.4, we get concerned and we have to start thinking about what is causing this fever, whether it's COVID-19 or anything else. There are a lot of infections in general going around right now. So, that's not the only thing that we are concerned about and may test you for.
Okay. And then what our last question that we have, unless we get anybody else that does put something in on the chat, is the current excuses for not getting a vaccine. So I'm sure you've heard a lot of excuses. Maybe you can just share some of them with us and tell us why they're not true or why there are myths out there about not getting vaccinated.
Yes, so I don't want to consider them excuses. I think people have a lot of reasons that they truly believe maybe the right thing to follow. And it's all about risk and benefit. Like I said, I got my vaccine very early on and I was nervous, when I was driving to get my shot. I was like, this is something new, something I've never been through before. But I knew that it was worth the risk, because I had seen so many patients with COVID-19 and I knew how bad it was. So the most common things that I hear, are people are afraid. They have fear. There's a lot of stuff that we read and hear about the vaccine, and that causes and instills a lot of, hesitation in people. Also, there are some people that have never taken vaccines, in their adulthood at all. So they don't want to make an exception for the coronavirus. They don't want to make an exception for the COVID-19 vaccinations. There's also, a lot of hesitation about the the vaccines, as some of them are new technology. We hear that this is a new technology that's groundbreaking, the mRNA, that causes a lot of fear in people too. And also the FDA approval that somebody asked about before, that's another reason that I hear sometimes, people are waiting for that official authorization, which we're hoping will be around very soon. And so maybe that will really help our vaccination rate here in the country.
Okay, it looks like we got one more on our chat, and they wanted to know, how long can the virus live on a surface?
That's a great question. So we don't really have a time, that I can give you. It depends on how much virus may be on the surface, what type of surface it is. Is it inside? Is it outside? What the temperature is. There's a lot of different factors. But in general, we do know that the virus does not live very long on surfaces, and it's very hard to actually contract the virus from a surface. I would say the vast majority of cases are actually from human to human transmission from just respiratory droplets. So that's why the masking is like the biggest way to protect yourself, rather than, cleaning surfaces thoroughly. Obviously in public areas, that's very smart, and hand washing kind of plays into, that as well if you're touching different surfaces. But, it's nothing that is the major route in terms of a risk factor for transmission.
Okay. And last but not least, this is my question. Do you foresee in our state in particular more mandates of things shutting down, no large gatherings, things like that? Do you foresee the governor coming out with any of those in the next week or two, or is it really just all up in the air?
I don't. And the reason is the mask mandate, I thought would be something that he may jump on. He strongly recommends masks, but did not mandate it. So I don't think that there's going to be a whole lot of changes when it comes to, the rules and the law. I do feel that he will put out a lot of strong recommendations. But in general, I know that, they are trying to balance the economy with public health. And so it's a hard, balance that I do not understand fully. But I don't think that we're going to see a whole lot of changes here in Virginia. So it's really up to us, to make smart decisions and to work as a community to really try to overcome this thing together.
Sure. Thank you again, Dr. Patel. You have been so patient with us and all of our questions. And thank you, Ian and Humana, for sponsoring this. Again, we're going to be able to put this on our website. We do have still in-person events that we are planning to do. I guess we're going to be doing them with masks on, and that's fine. We still want to be able to see you all come out. We have one coming up in a couple weeks in Virginia Beach and then one in Williamsburg. So I hope to see you all. Don't be scared to come out, but let's all just be as safe as we can. Everybody take care. Again, thanks, guys, for being a part of this and partnering with us.
Thank you so much for
Excellent.
having me.
Okay, have a great day, everybody. If you want to find out more about us, you can go to senioradvocate.live, Live. Thanks so much. Take care. Stay safe.